Welcome back to this Wednesday edition of your Coffee Break on the HAN Network. I'm Kate Chaplensky and joined by Dr. Eric Collins, the physician-in-chief at Silver Hill Hospital. Dr. Collins, happy to have you back on the show.
Thanks for having me.
All right, so we're talking about something important. Christmas is just a few days away. People are going to be having big holiday gatherings. We want to talk about securing medications during that time. Now, first, what do we mean by medications? What do you think is important for people to know or secure?
The most important medications to secure are the ones, well, I'm going to start with the prescription opioids. Painkillers, strong painkillers with a very high potential to cause addiction. At this time, for the holidays, from my perspective, it's always important to lock these away, all year round. It takes on somewhat greater importance during the holidays when people are having guests in their home, family, friends, relatives of other kinds. But when people are coming in to the home, if they have a problem with drugs, they will, not uncommonly, make sure they find their way to a bathroom with a medicine cabinet. And many people still keep their medications in medicine cabinets or in other places that are not that hard to find, and people do go looking. In a busy house, lots of people in the home, people will go look. I know this directly because I treat patients who tell me they do exactly this, and they do it on a regular basis, even all year round, but the holidays offer more opportunities to visit. So I'm talking first about prescription opioids, but really about any medication that has a potential for addiction. So that includes sedative medications like benzodiazepines, so that would be Xanax or Valium or Ativan or Klonopin, that type of medication. And not to be forgotten, we spend most time thinking about opioids, but also the stimulant medications that are prescribed at really quite high rates for both adolescents, even younger, children, adolescents, and adults for the treatment of attention deficit disorder. Those are also a great risk for addiction. People will go into medicine cabinets. I promise you, I treat the people who do.
Do you find that people are surprised that there might be someone in their life that's going to be going through their medicine cabinets? Do you think people, as much as we talk about the opioid epidemic and things like that, do you think it still surprises people that someone in their family might be struggling with that? That's
a great question. I think it does. I think people may not be so surprised that someone in the family struggles with addiction. Sometimes, it does run in families, and sometimes there have been prior histories. I think people are more surprised, in my experience, that someone will go and invade their home in that way. It's really a betrayal and an invasion, and I think people, no, he wouldn't do that.
Right.
My suggestion to people therefore is lock them away. Lock away all controlled substance medications.
Now, where should people lock them? Where should they put them?
So the easiest thing is to buy some kind of, if you have a safe already, lock them in the safe. If you don't have a safe, buy a lockable medicine chest or box, and those are the best places. I mean, you could try to hide them, and that does help somewhat because people won't have that much time unsupervised in various rooms in the house. You could put them in a room. If you have a room that can be locked, then just preventing access to the room where these things are would be an important barrier. Those are the main places we lock them, or we tell people to lock them.
We do hear all the time now about the opioid epidemic. As a professional in this field, how widespread is it?
It's widespread. Over the last 25 years, there's been a dramatic increase in opioid prescribing. It came about for a variety of reasons, good reasons. The problem is, they were thought to be good reasons. In hindsight, they were mistaken. The problem is there has been so much opioid medication provided out to the public that many new people are trying these medicines. So it's pretty widespread. The overdose death rates have been increasing every year for the last at least 17 years from the CDC, Centers for Disease Control statistics. They've been going up every year. They go up in lockstep with the amount prescribed. Really, they're parallel lines. And then treatment admissions for addiction to opioids have gone up similarly. I think we're turning the tide in terms of creating new people with addiction because of a whole host of efforts, new CDC guidelines on prescribing opioids, new requirements for doctors to check the prescription records. These haven't been available until the last few years, but now they're available and doctors are required to check. So we are stemming the tide of the overprescription of these powerful and dangerous medications, but there's still a very large group of people addicted.
Now, at the holidays, you're seeing a lot of family members maybe you don't see every day. What do you suggest for people that maybe see a family member and all of a sudden they're concerned that maybe that person's on something, maybe that person's struggling with something? What do you suggest they do? I know it could be difficult, especially during a holiday, to confront that.
Sure. So the first thing is for everybody to remember that addiction is treatable. It is chronic, often remitting and relapsing, typically remitting and relapsing, but treatable. It responds to treatment. So while I generally don't advise people have this hard discussion when someone's intoxicated. So if someone appears completely out of it, nodding out, glassy-eyed, somehow really altered from their usual self, then I don't think that's likely to be a good time for family members to speak to someone. So, the next day, assuming they're not, and also not necessarily in a public way at a family gathering where that's not likely to be an effective place. But a few people, the closest people, the ones, whether it's parents or spouses or children sometimes, have a discussion and express the concern and encourage treatment, or at least seeking some help. And then people can certainly call their primary care doctors to help get a referral. They can call Silver Hill. They can call any treatment provider that they know or can access. If people start that process, and many people are afraid to. Not saying anything only prolongs the period during which someone is continuing to use.
Right. And Dr. Collins, what would you say to someone that's maybe feeling very alone, very overwhelmed, whether they're a family member that sees another family member struggling or the person that's actually struggling with the addiction? What would you say to them?
Help is available. Get help. Call. Ask for help. If lack of insurance or some other obstacle might be in the way financially, or maybe even embarrassment of going to the family doctor, go to a walk-in clinic, go to an AA meeting or an NA meeting or some meeting. Those are free and relatively widely available, easy to find on the internet. Go ask for help. Go find someone who can help point you in a direction that can lead to recovery.
All right. Well, Dr. Collins, thank you so much for joining us. Such important messages right before the holidays. We really appreciate it.
My pleasure. Thanks for having me.